Dean, welcome to Dose of Health, episode number 3 of the series. I think today what we're discussing, again, it's your topic. And what I'll do is I'll basically tee this up for the audience, and then you can take it away and actually explain it in a much more simpler way. But
Yeah,
yeah, okay.
the
So
big one today.
huh?
It's the big one today.
It's the big one today. It literally is the big one today, which like, okay, let me just tee this up and then we can talk more about it. So imagine you go to a doctor with a mystery illness. You've got these vague symptoms and you manage to somehow miraculously get a top specialist to see you in that field. And even that person is struggling to piece together what's wrong with you. And then imagine an AI that can do this detective work step by step by asking the right questions, ordering the right tests, and solving your case, which could even stump the expert who spent all of their life preparing into that field. And that's something that we're going to talk about today. Now, why is it such a big deal? Well, in general, there are like huge problems in the healthcare system. Healthcare demand is exploding worldwide, and the costs to deal with those kind of demands is also going out of control. You have billions of people who don't get the right diagnosis, and also they don't get the right diagnosis in time. And even if you go to these advanced hospitals, misdiagnosis happen, delay happen, and loads of stuff does go wrong in a system where we think we have the best of the best. So is there a need for reform in that area? And that is what we want to talk about right now. So Microsoft came up with a new model, AI model, and it is claiming that it is performing better than the experts and doctors in solving one of the most complex cases in the world. So, Dean, take it away. What did Microsoft find, and what does that mean for us?
Yeah, Abby, this is not just a reform, like you're saying. This is a revolution. And these are the big boys coming in now. Like OpenAI, people think that they're a big boy, but actually their market cap, like the value of their company is something like 90 billion, I think something like that. But if you look at like the actual big boys like Apple, they're valued at trillions. Microsoft,
Google,
Google,
Alphabet,
they're valued
yeah,
at trillions. So
yeah.
they're actually the big boys. They're actually big tech. OpenAI actually like up and coming. So now the big boys are stepping in, and Microsoft and Google actually have been working in the AI health space. And let's start with what Microsoft have done, right? So let me share my screen. So what they've done is they've developed an AI doctor. This is the big thing that we're talking about today, AI doctors. And Microsoft have taken it a step beyond what our current understanding of AI is. So Microsoft have developed an AI doctor, right, called MAIDXO. And what they've said in their internal testing, it's come out as being 85% accurate, right? In this the New England Journal of Medicine, which is a high reputation medical journal, and in this journal they have medical cases. So essentially, there's 300 medical cases which are like test questions for the AI, and they gave it to the AI, Microsoft AI Diagnostics Orchestrator, and it was 4 times better than experienced doctors. So the reason how they got it was 4 times better, we'll get into it, but essentially it's because the AI scored 85%, and the human doctors grouped their average score was 20%. So it's a big study, but to be clear, it's not a peer-reviewed journal study. It's internal testing, but it's interesting nonetheless. So the reason why this is an interesting AI is because it goes beyond our current understanding of like good AIs, like effective AIs, where so Right now, like the best AI models are reasoning models, right? You might have heard of that, reasoning models.
Yes,
And
yes,
it's because before reasoning models came out, like the best way that or like the AI companies realized you can improve an AI is just by feeding it more data,
yeah.
right? But then when reasoning models came out, it's because the AI companies realized you can actually make an AI model smarter if you just let it think longer, right?
Mm,
It's like the second step of making AI smarter that doesn't need to keep feeding it more information. Now, what MAIDXO have done is instead of just having one AI, they have five AIs that are thinking and then an orchestrator model that takes all five brains into one. So they've gone even a step higher and created a higher level intelligent AI that they've been using for medical testing as an AI doctor. And so what this AI does is it's actually five brains and there's five different AI. Like there's like five different doctors in a way. So you know like the same way that we have a medical ward round
MDT,
in
yes,
hospital. Yeah, an
yeah, yeah,
MDT
yeah,
and how there's a bunch of different specialists and they all come together to make a team decision. This is what they're trying to replicate. So
yeah.
here there's like five expert, super expert doctors, and got doctor hypothesis, which is essentially like a doctor that whilst it's reading the medical case, it's coming up with a probability ranked diagnosis, like a differential diagnosis about what the most likely condition is, and it keeps updating as it gets new information in. You've got Doctor Test Chooser, which is constantly thinking about what tests we can keep doing to um, get more accurate information on the patient. You got Doctor Checklist, which is um, so this one is actually more just like quality control and making sure that every term, medical term and medicine name that is used in the chain of thought is correct and is
Mm,
valid and it's everything is consistent as everyone reasons. You've got Doctor Stewardship, which is more about actually money, like actually cost conscious and making sure that if there's a test that or an option that's been chosen, it checks if there's something that is more cost effective, um, like a cheaper alternative in a way, but also like diagnostically equivalent. And then you got Doctor Challenger, which is essentially like the devil's advocate, and
mm.
it essentially is always playing devil's advocate in the chain of reasoning and provides contradictory evidence. So that way they found that it can make it smarter. So then when a medical case goes in, these five doctors, essentially five experts, will all think together and come out with questions, and then it will request any tests that it needs to, and then it will provide a diagnosis that it needs to. That's how the AI was structured, and that's how, compared to humans, this AI was four times better, as it said here. And this what it used the AI brain that it used was OpenAI's O3 model, which is
Mm,
actually the old model that doesn't it's not used anymore. It was replaced by GPT-5. So even
mm,
with the older model, it scored 85.5%. And
mm,
then 21 doctors across the UK and US, each with 5 to 20 years of clinical experience, were the competitors, and the average score was only 20%, which sucks. So
mm.
this is I mean, it was an internal study, so it does need to be like reviewed and checked to see if the results actually stack up outside in the real world. But it's powerful finding.
Interesting. So let me add a little bit of more context to the story that you have said as to like why something like this was important. I think the misconception could be that Microsoft is here trying to take over the doctors or trying to replace the doctors. But in reality, what this model did is it actually replaced the previous AIs. And previously, the test for AI in medicine was to use the multiple choice exam style questions, like how you would get it at the US medical licensing exam. And these AIs were very good at passing the exam, choosing the right option between A, B, C, and D. But in reality, that doesn't mean that you can diagnose correctly. So what Microsoft did is basically they came up with this model where they got like 5 of these doctors collectively coming up with the diagnosis. And they also created something called a benchmark, like an SD benchmark. Do you know about that SD benchmark, bro?
It doesn't actually ring a bell.
Okay, let me explain. So, like once you create this model, like the one that these guys made, how do you actually test that all these top 5 doctors are doing the right thing? So, they created this test. Basically, think of it as a huge test where they got New England Journal of Medicine and they basically picked 300 of the most, around about 300 of the most
Okay.
complicated cases. Most complicated cases that were published in New England Journal, and they basically fed that into a system, and then they tested this model and said that is this model going to be able to find the correct diagnosis which was published in the paper. So basically the AI starts with a patient's story, like symptoms, age, background, and then there is this step-by-step, asking questions, doing tests, and then you keep updating your reasoning through the model, and eventually this model will then come up with a diagnosis. So say, okay, based on everything we've discussed, the diagnosis is some kind of a sarcoma or cancer. And they did that for 300 of the most difficult cases published in New England Journal of Medicine. And then what they did was they got these doctors to do the same thing. So the doctor could ask the same questions, these doctors with 5 to 20 years experience, and they found that the model got the diagnosis right in 85% of the cases, whereas a doctor only got it right in 20% of the cases.
Yeah, that's the average as well. Like there were
Insane.
some doctors that were terrible, it's averages like at the 50% mark. But we can actually show you, I can actually show you what it was like when it was compared against individual doctors, because
Yes.
that's the average, right? So yeah, so the SD bench is essentially what I was saying about it is essentially the 300 medical cases from the New England Journal of Medicine
Yeah,
as created as the benchmark
that's
itself.
right.
Right, I see. This is the this is the actual like table that shows the results. Let's scroll down a bit more. It's a bit stuck actually. Hold on, let me see if I can open it here so you can see that
That's
better.
it. Yeah. Yeah.
Okay, MAI. So this at the bottom here is the average cost of all the tests,
Mm,
and then on the side is how smart it is, essentially what the percentage that it was correct in
accuracy.
the tests. So they tested MAIDXO at multiple different levels. Like the first one was when it only could give an instant answer. Like it couldn't ask questions. It had no money to run any tests, and it was pretty bad. It scored like less than 40%. But then it kept getting better when they allowed it to ask questions. And then it got even better when they gave it money to run tests and then pull out a diagnosis. And it was really good when it was just had infinite money and infinite compute power. Um,
Mm,
so the best so they tested it against AI models as well, just AI models running on its own. And the very best AI model was ChatGPT's O3 model, which when
mm,
they done that on its own, without the 5 different doctors, it was just the one AI. It was great. Like it was really as good, nearly as good as a model, the MAI model that was allowed 8K to run tests. But the reason why it's so far to the right is because O3, it spent a lot of money in itself. So it was very expensive in comparison to how smart it was. But where's the humans? You might think the humans are all the way down here. Like this is the
mm,
average of the humans. And actually there's another graph that shows the breakdown of individual humans because this is just an average, right? Yeah, I'm not sure where the other graph is, but when there's the average of when this is just the average of humans, so there's 20 different doctors, and in the other breakdown, it shows that the very smartest doctor was only up here, was only as good as the 40% mark, and the very worst doctors, some scored zero. So, you know, if you're in a real life situation, you're depending on a human doctor. If it's essentially a lottery. And if you have, unfortunately, you have a doctor that is not so good, you're going to have worse outcomes. But even if you have the very best human doctors, it's only going to be as good as the worst MAIDXO, you know, that could
Yeah,
only give,
yeah, yeah.
that didn't have any money and couldn't ask any questions. So yeah, it's an interesting finding.
They actually did say in the limitation that one of the problems with that type of testing was that the doctors who took part in the study did not have access to any textbook, did not have access to any resources, and they did not have access to other doctors. So whilst this model was working as an MDT, those doctors were working as individuals, and that could mean that their percentage could have been higher than 20% if they had everything that you would have in the hospitals. But the truth is that even if it was double, it would still be like 40% for a doctor compared to 85% of the cases, which was in this case.
Yeah, that's a good point. And you know, the reason it's a valid point to bring up, because this is not how healthcare staff work in reality,
Exactly.
right? So, but then the reason why they did that was because they needed a way to make sure that the doctors were not just Googling the answers, you know, or there
Yes.
wasn't someone just Googling what the answers were. So yeah, it's understandable, and it's a valid drawback to
Yeah.
the results.
Yeah, I mean, because we want to address that as well. It's not just all about AI. There were some limitations that it wasn't directly a simulation of how real life works. Bro, why does cost matter, do you think? Why did they involve cost into this assessment and not just the diagnosis?
Yeah, I mean, it's a factor. Like we will say that it's not always like the number one most important factor, but
Yeah,
it's definitely there because you know when we're thinking about um, as like a government or a healthcare system or an organization giving healthcare out to people, if we don't think about cost, it means that we're not properly thinking about doing things for the long term. And
of
yeah,
course. Yeah. I mean, well, think about the cost of healthcare, right? In America, 20% of their GDP is going on healthcare. In the UK, you have over 300 billion pounds is just being spent on the NHS right now. And working in the NHS myself, I can actually tell you what happens when we are ordering tests. So usually these electronic system, all these tests are actually arranged in a bundle. So you can just say a full blood count, for instance. It's a name of a bundle. And within that bundle, you could have 35 tests, right? So it just may be that a doctor needs just to check what the kidneys is doing. You could just choose a bundle and suddenly you've ordered about 30 tests. And that's just in general medicine. In specialist medicine, it could be even more expensive tests. Let's just say you want to check how your kidney's doing, but you by default sometimes order cholesterol test because it's all a bundle. They are not individual tests. But in this scenario, these models are actually going to be individually telling you these are the tests we want. So overall, when you think about it, it actually becomes very cost effective because because you're not doing these bundle testing. What you're doing is individual tests that is needed only gets ordered. I mean, I've been onto ward rounds so many times where a consultant would be checking the bloods in an infectious diseases ward round, and he'd be like, "Why did you do the Epstein-Barr virus test? I I actually did not need that test," and it just turned out it was bundled into a bundle. And of course, if you times this by however many million people NHS sees and orders bloods, you could be looking at saving millions a year.
yeah, that's it. Millions of the key thing is that this is unnecessary as well, you know. So the cost difference between just ordering one test versus a bundle is big. You know, it can reach up to hundreds of thousands even, right? So
Exactly.
so yeah, that's it. And you know, the cost it's not always like it because the outcome can be it can actually be like unfortunate outcomes for individuals, because if there's something that's super expensive to run, like a test or a treatment, the NHS won't like license it and have it available for the public, which means that actually some individuals could miss out on a treatment. But it's unfortunately a decision that needs to be made on an entire societal level, because otherwise things can become unsustainable, and we're already at this breaking point in costs with the NHS. So yeah, this is the unfortunate truth around money and how it runs in the system.
Exactly. It is one of those things that you have to understand that what are the smarter ways to save money, which will get a bipartisan response. People on the left, people on the right, people who are pro NHS, people, everybody, I think, would actually think that, yes, it makes sense to save money where wastage is happening, and ordering unnecessary tests is one of them, isn't it?
Yeah,
Um,
that's it.
Let me ask you a philosophical question, bro. Like, does this mean AI is smarter than doctors?
Yeah. Yeah, yeah. I mean, it's I guess the question is like, we're seeing a lot of evidence. This is just one example, but there's loads of others examples of studies, experiments where the AI is given more accurate medical diagnosis than a doctor, which is, I guess, like the number one most important like trait of a doctor, or like the most important action of a doctor is diagnose and treatment. So in that sense, there is evidence coming out that it is better. But then I guess the question is like, what else do healthcare staff do? They do more than just make decisions. They work with people. So in terms of just raw intelligence, it looks like the AI we're already there in a space where it's already smarter than humans. But
Mm.
there is an issue where AI has something called hallucinations, where it will just very confidently make stuff up that's wrong. And so I think this is the reason why we haven't seen that full explosion out into the system yet, because it still needs to undergo rigorous testing to make sure that it doesn't hallucinate and make stuff up. And yeah, like it's still not clear also if the AI can actually be smarter than humans when it comes to that real time contextual judgment, you know, because there's a lot of the skill, or I guess, of a healthcare worker or a doctor is that when you're speaking to someone or a patient, you can pick up on things that aren't numbers, that's not lab results, like the way that the patient is speaking, subtle human signals that will indicate that there's actually something that is not being picked up in all the tests and all the numbers. So, it's still not clear if the AI can replicate that or match that. But in terms of the raw capacity for medical knowledge, I think we are already at a point where it's surpassed humans.
I asked ChatGPT, how many health requests do you get on a daily basis? Obviously, it didn't really give me an answer, but basically, it says that in the US, 17% of adults say that they use chatbots at least once a month for health advice. So basically, millions of people are accessing ChatGPT or large language models for healthcare advice. I think it was a trick question that I asked, and it can be a bit of an antagonizing question because doctors spend 10, 20 years to become specialists. My biggest problem is that the knowledge of a very super specialist expert doctor is only limited to his or her patients. That's the biggest issue I have. And look, I'm a HIV specialist pharmacist, and I've worked with unbelievably great consultants. Like, I don't want to name one name, but there are like un- incredible brains, and the results speak for themselves, like how amazing they have done with regards to, if you look at our HIV results. But, 2 out of 3 patients who live with HIV are actually in Africa. They are not in the West. They are not in South America. 2 out of 3 patients, 67%, are in Africa. So the patients who are getting the benefit from this expertise of the consultants who are in the UK and US, and not to say anything bad about the doctors in Africa, but imagine if that super intelligent model is able to be accessed in Africa any time of the day for just HIV or infectious diseases. Like, just think of the impact that whole thing is going to make. I think it can be just life-changing for people. And it's going to save money, and it'll be speaking in your own language. So it's not even about challenging the doctors or checking who's smart and who's not. That wasn't the aim. The aim is that how do you democratize your own knowledge that you have gained over 10, 20 years? Will you do that by these models? Because
Yeah,
they can be used anywhere, and it can change your life whilst you're doing your job. Here in the UK, your brain can actually be used. Your expertise actually can be used simultaneously in the place where it's perhaps more needed. So you're leveraging. AI basically leverages,
a hundred.
the medical knowledge, right?
Yeah, 100%. Like that's the thing that we haven't spoken about. We're kind of just subconsciously talking about the West here, but we're not talking about there's billions of people, billions of people who do not have access to adequate level of healthcare or a standard of healthcare that we are fortunate enough to have in the West. Billions of people. And the big word that you used is democratizing, because if it's an AI, it can be put out at extremely low cost, extremely low cost. Like imagine it, comparing it to what an alternative is today of getting an expert medical doctor from the UK or the US, flying them out, and then they're only limited to whatever vicinity they're in, and also limited in terms of their own knowledge, as you said. But now this is massive, widespread across the whole continent for cheap without having to fly anyone over. And it can be used as a layer, another layer, not as a replacement in the sense of a human, but, doctors in other parts of the world that are lacking a high standard of healthcare can use it as the first initial tool. So yeah, it really brings up the level of healthcare rapidly in that sense. And another thing that made me think about is comparing an AI doctor to a human doctor in terms of training, right? Because you mentioned that human doctors, even the very best, are limited by the patients that they see. So I guess when I'm thinking about it, like what is the cost and time to train a human doctor versus an AI doctor?
Yeah.
Like a human doctor,
Yeah.
they take 25 years, right? You need to
Sometimes
go,
decades.
yeah,
Yes.
even longer. You need to go through the schooling system. You need
Yeah.
to go to university. So you learn about you build that knowledge up in medical school,
To,
and then
to,
you take,
to train one brain.
yeah, and then you've got the extra few years where you're actually a foundation year doctor, and you've trained one brain. It's taken decades, and hundreds of thousands of pounds or dollars sometimes, um, and then compare that now to an AI brain, which yeah, for sure, it does cost millions to train these AI brains, but they've been trained in a lot less time. And the other thing is afterwards, they can be used at a much, much, much lower cost, like 99% lower cost. Because once it's built, it's just a case of updating the brain, and yeah, it can just go out there, democratized for everyone for cheap, compared to a human doctor, which they will still be updating their brain, but as you said, it's just on the patients that they see, and maybe some papers that they might read, and speaking to other doctors. But comparatively, to me, there's no contest in that regards.
Let me actually give you an example, bro, because I think examples really hit home. So I was in Delhi, India, and I was with a friend, and the friend had an exam the following day, and it was a viva. So, you had to go in and give a physical exam. And my friend had a really bad sore throat and a bit of a cough. right? Now, I didn't say anything. I didn't use my pharmacy knowledge, but I went to pharmacy with this person. So what happens is in like big developing cities, this happens in Africa as well, that people tend to go to pharmacy first, like a community pharmacy first, and just say, these are my symptoms, and then they will get medication. So it's a much cheaper way to access healthcare rather than going to a hospital, paying for a hospital consultation, seeing a doctor, getting a prescription written, coming back, giving it to a pharmacist. A lot of these developing world people go straight to pharmacy. So my friend goes to this pharmacist, community pharmacist. I was there, completely silent, and my friend said, look, these are my symptoms. I've got sore throat, and I've got a bit of cough, and I have a very important exam, so I need a quick fix. That's what they said. You know what the medication the pharmacist gave him? Ask no questions. No allergies, no other symptoms, temperature, none of that stuff. He gave them ceftriaxone, he gave them diclofenac, and he gave them fluconazole. Okay, so for audience who wouldn't know, ceftriaxone is such a broad spectrum, second line using antibiotic that you would never just give out without a prescription in the UK. Fluconazole is this antifungal drug that there was no reason to give fluconazole here either. And diclofenac is a very strong painkiller. It's not something that you would use first time. So this guy gives my friend these 3 drugs and said, you'll be fine tomorrow. And guess what? My friend actually felt symptomatically better enough to do the test tomorrow. Right? So what happens is a false illusion is created in my friend's head that this pharmacist knows everything because my symptoms got better, right? But in reality, did my friend need such a broad antibiotic and also even 2 capsules? It wasn't even a course to say, take these 2 or 3 capsules. So thereby, this pharmacist has now suddenly got this moral authority. And the second order consequences of that is that my friend's now going to tell, oh, go to that pharmacist. He's very good. This person got me fixed quick. But no, he didn't, right? That was probably a viral infection that got treated by itself. You did not need antibiotic. You certainly did not need an antifungal. And you could have been just fine with paracetamol as well. And a bit of rest and a bit of fluids. And you would have had the exact same outcome. But this pharmacist made money out of you. And you thought he did you a favor. So I was, in a way, really shocked to say, my God, this actually happens in real life. And I couldn't challenge my friend either because they're like, well, what do you know? I got better. So this entire thing of, like developing world has got these antibiotic resistance scare, which is coming from Africa, which is coming from India. This is how it happens. And imagine now if you give this AI tool to both. I'm not even saying to my friend, give this to the pharmacist and give this to the friend. Imagine the level of conversation these people can have now. And imagine if my friend is able to question, to say, why have you given me fluconazole, which is an antifungal, versus the pharmacist who would not have even suggested it in the first place because that model would have told him, look, the symptoms are not representative of anything fungal. This patient does not have diabetes, or this patient has not got any symptoms for any fungal infection. So that's like one of the thoughts that came into my head, that this is how this model is going to completely democratize this model, this care in the developing world.
Yeah, that's such an interesting story because the outcome is it actually worked. Like he got better is the outcome. Whether the medicines helped that or not remains to be seen. But your friend got better, so
yeah,
it's like there's other factors when it comes to this that depends upon if the healthcare is public or private. Because if it's private, there's an incentive for healthcare companies to want to sell you some sort of product or medicine, even if it's not what you need, which is it's slightly irresponsible because, as you said, it risks antibiotic resistance, and you're not checking properly if that's actually what they need, and it risks side effects, interactions, allergies as well haven't been properly checked. So I'm trying to look at it though from the perspective of the pharmacist in India, because they are essentially operating in a space where they don't have they don't run tests, right?
Yeah,
They don't need to just actually give some advice or
empirical.
some
It's
product.
all
Yeah,
empirical. Everything is
immediate.
empirical. Yeah.
So the funny thing is that it actually worked. Like your friend got better. So then, is
Well,
there
I
a
think,
case that
yeah.
the pharmacist is also like utilizing the placebo effect? Because as long as they know that they give them something, if they do feel better, they got better. So that's what
Yeah.
they'll say.
To be honest, bro, if you ask my personal opinion, everything about that was wrong. I know what the pharmacist is doing and what that person is doing. He's realized that there is an acute problem here, which is pain. So the minute you alleviate somebody's pain, people think that you must know what you're doing. But in reality, what this pharmacist did was he threw a kitchen sink at something which required water, paracetamol, and bit of rest.
Yeah, it
Do you
would
know
have
what I
been
mean?
interesting to see compare it to if your friend was a doctor in the UK and they were about to have their viva the next day. It's a very important, like exam, and it's quite stressful, and you want to make sure that you're like as healthy as you can be for that. But what would have happened? Because like what I can predict would have happened is they would have gone into a pharmacy, and then the UK pharmacist would have been like, um, we can't give you antibiotics without a prescription.
Yes.
Definitely can't give you an antifungal. Diclofenac is very strong. So like what the most like sensible approach would be is to just keep hydrated, take paracetamol, take ibuprofen if you need. It would have been interesting to see what would have the outcome been uh, in that case compared to throwing the kitchen sink at it.
We will never know. I mean, the thing is, you can never do a direct study of how pharmacists behave in the UK versus in India. But if we were just talking about like who is going to really benefit from this new AI model that Microsoft has come out, I always think of the developing world because I think these models will actually completely transform healthcare in those countries a lot more than here. Especially, I have a bias because I'm an infectious diseases pharmacist. So if you compare infectious diseases in this country versus in the tropical countries, it is night and day. TB is still the number one killer of HIV patients globally. So, and in the UK, TB cases are handful. So this is just one example. And the thing is that patients just want to get better, and patients sometimes don't really know what questions to ask. And sometimes even healthcare professionals don't really know what questions to ask if you don't have all the tests in front of you. So this model, I think, democratizes and helps both the patient and the healthcare professional. That's just my angle because, we usually just talk about the UK. We haven't spoken about the global world yet. And I was thinking, my God, when we were going to discuss this topic, I was like, actually, the impact's going to be unbelievable, like
Yeah.
globally.
So have you seen what Google have done with MedGemma? You heard
No,
about
not yet. No, I
that?
haven't. No.
Should we talk about it quickly?
Yeah, 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 yeah.
This is another one of the big boys basically coming in, and what they've done so is they've trained their own AI called MedGemma, and what this is it's an AI that's been trained on millions of medical records. So
Wow.
like literature, questions and answers, electronic health records, but then it's also been trained on medical images, so like x-rays, pathology slides, dermatology photos. And what they've done is created this model called MedGemma, which is 27 billion parameters, which essentially now it can interpret patient information and answer medical information. So it's essentially Google's AI doctor, right? This MedGemma. There's also this other one that they've trained called MedSig, which is specifically just been trained on 33 million medical images. So
Wow.
this is an AI that's more specialist in terms of images, so it can help like classify. Um, you can give it dermatology pictures, and it will be able to classify if there's any illnesses that have been seen in any kind of radiology, dermatology, pathology, ophthalmology images. And a MedGemma is more of like the overall one, that the bigger one that is also been trained on medical text as well. So this is like Google's answer to a medical doctor, but the very, very different thing about this, and what I salute Google about, is because what these are is these are open source. So
Wow.
open source means that anyone can download them for free. Anyone can use it for research and development. Anyone can modify it. Anyone can deploy it into their own hardware, into their own system. And that's the different, really big different thing about what the Google and the Microsoft AI doctors are. Because the Google ones are open source, this is open source is like my favorite phrase, like
Yeah.
in technology in the world, because it now means that
Access to
anyone
everyone.
can, yeah, it's fully democratizing with
Access
not
to
even
everyone.
any cost. It's not even any cost. So the great thing about this is because, you know, one of the big worries with organizations that are looking to bring in AI is privacy and
Yeah.
safety. But because it's open source, it means you can just download the model and you can put it in your own hardware. You can put it in your own system, and you don't need Google to have any part of running it. You know, the question is, why would Google do that for me?
Yeah.
You know, it's still not clear. But when I think about it, I think about how specifically with healthcare data, it's very sensitive data. There's very strict regulations, especially in Europe. There's a GDPR. The US have the HIPAA, and it means that because the models are open source, it can run on the healthcare organization's private cloud infrastructure. So there's already like a reason why now people will be like, okay, let me choose Google, and you don't need Google to help run it. But if you do choose an AI model like that, you do need some sort of infrastructure, some sort of or some sort of compute power to help run that AI. This one possible way that they could have been thinking about it is, okay, people will choose our Google open source model, but it also means now they need compute power, which Google will also provide with Google Cloud Platform, you know? So it's like a natural complementary system to run in, which you do have to pay for the cloud platform. Or, you know, it could be just brand building, reputational, because
Of
as
course.
soon as Google released this, they don't need to make money because they're making money for all other things like advertising and whatnot. But now it would put their like marker in the ground for them being a leader in open source AI, especially in like a critical field like healthcare is, which will enhance Google's reputation as an innovator, and, you know, just being responsible, and, you know, those reputational benefits, like massive reputational benefits, can come down the line from that as a goodwill thing. I think it's more
Of
of a
course.
combination of all of those.
Of course. I mean, healthcare, our core belief is definitely that it is so ripe for disrupting, right? People deserve good care. And in reality, when we look at any big problem, it is not a wrong thing to say that technology has changed it. And AI is a technology that is going to change healthcare. And these two companies are basically showing us. Bro, 10 years from now, do you think we will still go see a human doctor or just talk to an AI?
Yeah, I don't see it as like binary.
2035.
Yeah, I
Mm,
don't see it as like a binary thing. I think it's more of like a percentage spectrum thing, where right now, even right now, you know, like we're using AI for maybe like 20%, so maybe like I don't know. There's some percentage of our medical like decisions, medical questions, where we're using an AI instead of a human. And, you know, for some people it's like nearly 100% because they just have like minor questions, minor things. And then some people it's like some people 0%. Even like today, you know, I guess some of the older population as well that aren't used to AI, even if they have a minor question, they'll walk into the pharmacy and ask a person. But I think the trajectory that we're going in is the percentage of questions that people will revert to using an AI instead of a human is going to increase massively, up to a point where, you know, some people will be using it for everything, like 100%. Uh, and, you know, I can see why that would work. I guess
yeah,
there's a small point where as soon as you actually need some sort of treatment, then you go to a human. You know, it's 100% up until you actually need something, and then you'll speak to a human, which to me is the most actually efficient way to do it. You know,
of course.
there's a
Of
bigger
course.
question about, well, what do we do with all the humans then? But I still feel like the most sensible way and the most likely way that I think things are going is we're just going to outsource all of that core raw intellectual knowledge to the AI brain, and then everything else for the humans.
Yeah, I think that's what maybe Wes Streeting hinted in the NHS 10-year long-term plan when he said the doctor in your pocket. I think that's what you mean. Like, this is literally what it's going to be. Like, there's going to be a doctor on your phone. It could be an app. It could be another device.
Yes,
But
the
yeah,
NHS app, right? That's it.
yes,
That's the
yes,
idea in the UK. The idea is, the AI doctor will be on the NHS app, which will
yes.
be more integrated with NHS procedures and regulations and pathways and processes, and it hopefully will not have as much risk of hallucinations and make stuff up.
Yeah, exactly. We remain optimistic. I think it's a net positive to humanity. And like you said, it is revolutionary. Any doctor who feels threatened by it, I don't think you should. If anything, I think you should go all in and actually, read more about it and then try and figure out what would you do if you have this as an MDT doctor. That's the thought process that I would want a doctor to have. So when you're doing a full-blown MDT and you've got all these healthcare specialists sitting, you've got specialist pharmacist, specialist nurse, you've got registrar, you've got 2 consultants. Imagine this is also loaded up on your screen. Whilst you're checking the x-ray, whilst you're checking the bloods. Just imagine if this is also open in a tab, how amazing would your life be? That is a thought that I would want to leave to any healthcare professional who's feeling threatened by it, because I think it's going to be life-changing. So it's not really coming to replace you, but if you think you're an expert now, boy, you're going to be recognized worldwide. You're going to be like Steph Curry of the NBA.
Everyone's going to be like Steph Curry.
That's
That's the
right.
thing. Everyone is. So then, yeah, I don't know how the world looks like then.
Well,
But
I think,
to me, it's
well,
better. It's a better
yeah.
place than before.
Yeah. I think, like, this is a hunch, like, different people will use this differently. I think, like, there will be human beings that will, or the doctors and healthcare professionals that are going to shine above others. Of course, it's actually going to lift our knowledge by an order of magnitude or maybe 100 order of magnitude. But I reckon when it baselines, you would still have some humans who are going to be able to set themselves apart from the other
Yeah,
human
that's
beings.
interesting. I feel like this is because the knowledge will all be there.
Yeah,
The knowledge will all be
yeah,
there. And in the healthcare space, it's actually going to be very narrow. Like it's
exactly.
going to be integrated into whatever program you're using. Scope for like like creativity, I suppose,
Yeah.
is actually going to be less. So
Yeah.
I feel like what is going to be the key differentiator is just trust. Is doctors and other healthcare staff like saying, okay, this knows more than I do. I am going to ask this instead of coming up with my own theories or whatever, or test my own theories with this. Use this as a co-collaborator, in a sense, because like one of the things that I've seen, I'm sure you have, is you've got some of them like expert doctors in their field, but as they've got older, they haven't fully updated their
Yeah.
information or
Yeah.
their knowledge base compared to
Yeah.
whatever the modern day guidelines are. So they will still, even the expert doctors will still be like, okay, I've seen this patient, I want this treatment for them, even though that's not what the modern day guidelines are saying. It's just what they learned was the best like
Yeah.
20 years ago and haven't updated their own priors. So actually, if that doctor used the AI and had the trust, or it's more like the habit to use it, and the confidence and the ability to know that they're not going to get like uh, like put down for using it,
Yeah.
and
Yeah.
actually
Yeah.
going to get a better outcome. That's where I see the revolution happening.
Yeah. Yeah. You're going to have to integrate this in your workflow to say you have to use it for those doctors. But yeah, another fascinating discussion. Please let us know, what do you think about this new model? Go to their websites, check it out. I'll actually put it in the link. And are you fascinated by it? Are you gobsmacked by the fact that 300 of one of the toughest diagnosis cases that were written in one of the world's most popular medical journal, Chat GPT, well, OpenAI's or Microsoft's model was able to predict the correct diagnosis 85% of the time, and it was cost effective compared to 20% that real human beings were able to do it. I mean, boy, that's a fascinating thought. Let us know. Let us know in the comments what do you think about it. Would you use that in the future to get the right diagnosis, or would you still trust the expert? Bro, let's just quickly go to like a couple of questions that people
Yeah,
have asked us.
I got one
Okay, you go. You go first.
one that I like is kind of pertinent to what we've been talking about, and it's a thought experiment. And
Give it
it's,
to me. Give it to me.
the question is to you, Abhishek, you can go back to the 1500s and you can have any amount of money that you want, right? How much money would you like? You have any, it's infinite. The question isn't actually how much money would you need to go back. The question is, would you go back to the 1500s if you can have, you go back there and you can have any amount of money that you need? Would you go back?
Would I go back to 1500s and basically live my life there? I'm not going there to do a sneak peek.
Nah, you're there now. The rest of your life's there, and you got infinite money essentially, or like near infinite money. But you're living in the 1500s. Let's say like in England, like say,
Bro,
or India.
yeah. I think a lot of, well, the answer is no. The short answer is
That's it.
absolutely
That's
no.
it.
And the reason for that is I try and increase my knowledge about money. And money to me is, again, a means of exchange. So I don't think any amount of money in 1500 is worth not having penicillin in your life. any amount any amount of money is not worth not having clean water,
Exactly.
or
Yeah, exactly.
and the on-demand economy that we have. And also, bro, I mean, I don't want to get political, but freedom of speech,
100%. Your
and
life's at risk.
and by default I will be poorer than where I am. Like, even the lowest of the lowest quadrant in this current day and age is actually much richer than people who were in 1500s. Even the poorest guy who's living in the
In terms of life
in a
quality. Yeah.
exactly. In a council home, you still have a microwave, you still have a washing machine, you still have a television, you still have heating, even though it's expensive, but it's there. Uh, the point is, none of this was there in 1500.
Yeah,
So,
that's it.
that's an easy choice for me. What about you?
Yeah, it's interesting because most people would say no. You got some people that say like, oh, I was born in the wrong time. I wish I was living back. It's just be by the fields, chilling all day. But I'm just like, you don't understand what life actually was. Even if you were a king, there's not proper sanitation. There's no proper sewage facilities. Don't have proper hot water. It's limited. You're eating pretty much the same kind of foods. There's no internet.
But
There's
your
all
mortality was probably like 40s or 50s. Like, you'd be
way higher.
lucky to,
Child mortality was massive. Mothers
yeah.
were dying from giving birth. There was no anesthetic. Remember,
Mm,
and like
mm,
people were dying just because of like tooth infections. Like that's like a
mm.
lot of people died because they didn't even have proper toothpaste. Remember? So it's like I don't think but when people say yes, it's like I don't. There's just a small subset of people. I don't think they actually think about what life would actually be like in the future. And most people actually say no because of all the things we spoke about. And like the reason why I like this thought experiment, I heard this from Dwarkesh. Actually, Dwarkesh.
Yeah, Dwarkesh Patel, like his podcast.
Yeah,
Beautiful. Yeah.
I heard him
Oh,
say it. That
interesting.
really triggered it for me because the idea is if we can like both agree that going from the 1500s to today has been an insane leap in life quality to the point where there's no amount of money that will make us go back. We can now project to the future and be like, okay, is it likely that the future is going to be one where when we look back, it's going to be such an insane jump in life quality that people in the future would not take any amount of money to come back to today?
Mm, well,
So
oh
it
God,
gives me hope, it gives
you
me
you
optimism about
you
it.
really got my brain thinking, and I actually don't know if the future is linear like that. For instance, in the political world we're living in right now, something terrible could happen, and boom, like we could actually go back a few years. Like, I mean, I don't even want to say the nuclear word, but I hope you're right. And to be honest, if you push me to the corner and say, "What do you think?" I probably agree with you. to actually say that, the future, if we carry on the technology trajectory that we are going to, and if we are able to cure these conditions that we have been grown to believe that chronic conditions are not to be cured, they are meant to be managed or treated. That stage 4 cancer, well, it's put your affairs in order. This is what HIV patients were being told in 1980s, or early 90s, that HIV is a death sentence and people were dying. Like, this is what we are telling people now who have stage 4 cancers or metastatic cancers, right? Why should we accept it? Is the thing. Why should we accept the fact that type 1 diabetes will never be cured? I think these are the radical ideas that we don't even think about it and we don't even discuss it. But AI is now suddenly making these kind of statements not sound like some kind of crazy talk, but actually it is possible in the future,
it's
right?
it's like the beginning of the thinking that it's
New unlock.
actually possible, rather than just being a complete wild theory.
That's
Still a lot
right.
of work that has to go into it, but it makes a lot more sense. Like what you're saying around how we've actually been conditioned to believe that chronic conditions are always going to be managed and
We're
never
just going
cured.
to manage it.
Like
Yeah.
never cured. Like this is an idea that is so fixed in society, and I guess like
Yeah.
right now it's true, right? It's true. You can say like it's true, but projecting to the future, this is one of those core limiting beliefs that I think
Yeah.
really be challenged, which is powerful.
Yeah. Why shouldn't we challenge is the question. But anyways, I mean, we lingered on that. That was a good one, bro. That was a good one. Let me give you one more and then we wrap it up. What skills or qualities, if any, do you think will be AI proof in healthcare?
Yeah, that's a tough one because even earlier when I was talking about how there's things that human doctors or like healthcare staff will pick up from human patients, subtle signals, tone, body language. This is like initially like the realm that AI can't touch, but then it's like, what if like the AI is watching someone and uh, like all kinds of dystopic like timelines attached to this. But what if the AI was watching someone and it can pick up micro expressions and micro
Yeah.
frequencies that it can tell, okay, this person's actually not like saying the whole truth, or like not trying to sound too dystopic, but it's like, okay,
Yeah,
no,
yeah, 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 yeah.
there's something extra here that isn't being picked up in the lab readings that I'm picking up. Maybe this patient is showing some very strong signals of severe depression. That isn't
Mm.
up through any of the blood tests. And so this realm that was like, maybe I said was just humans only, not AI, can actually theoretically be like be disrupted with AI. So then it's like, what else is it? Like the only thing that I can think of is like love. It's actually like a direct human to human compassion and
Empathy.
like love and empathy and reassurance. That's like the only thing that I can think about that AI can't touch, because all these other decision healthcare based like knowledge based things can all be theoretically disrupted with AI.
Absolutely. I mean, human love, connection, empathy, sometimes I would say values as well, like ethical judgment. So let's just say that you have a 80-year-old patient who has, God forbid, a very deadly form of cancer. Or even not even a deadly form of cancer. And the AI and the best AI model will say, okay, give this person this chemotherapy. But what if the patient says, you know what, I don't want to go through this. I don't want my hair falling. I don't want to vomit all the time. If you're telling me this is only going to improve my life by one more year, I don't want it. I would rather do these things that are on my bucket list that I haven't done. I don't think that AI would be like, oh, yeah, this is the right answer.
Mm.
You know, the AI would say, no, 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 you need chemotherapy. That is the right answer. So I think that with these ethical judgments, you need that human connection, like where you're
Yeah.
able to deal with like uncertainty and I mean, that's a very philosophical thing. But I think for the nearest future, when I would say at least 10 to 20 years, bro, I even think things like being a nurse. being a physiotherapist, how you use touch, you use dexterity, and you use like real-time decision making when you're assessing patients' mobility. I feel like these hands-on skills are actually safe for a fair few amount of time. So eventually it might go if robotics take over, but I feel like something which requires hands-on experience will actually be safer in the near to mid to even long-term thing.
Yeah, yeah. There's like two categories in a way. It's like what is okay like for the next 10, 20, maybe 30 years. But then I'm thinking past that. Let's just
Yeah.
imagine robotics that does take over. And then what? And there's the ethical boundary situations. Yeah, I agree with you there. I think it depends also on how the AI is built from the beginning, because the AI is only gonna like represent the values that it has been trained on itself.
Yes.
So
Yeah.
it would be it's yeah, these ethical gray areas are always like the big questions when it comes to these AIs versus the humans, and it's really interesting to see how it comes out, because like maybe you need a specific AI that is just trained on ethical questions and like legalities, or because even in like saying like in the NHS now, most people on the ground would agree that we don't want to, it's not actually like in the best interests for the patient if we plug them with like a ton of chemotherapy, but it's just what the guidelines say to do. So
Yeah.
like even today there's cases where humans, healthcare workers and doctors are making decisions based on the guidelines without actually like fully taking into account the patient's needs, because there's this culture in the healthcare system of just prolonging life by any means necessary. But as we've spoken about, is it actually about lifespan, or is it more about health span? And
Quality
the
of life.
quality
Yeah.
of life, the time that you are here, making that as good as it can be.
Absolutely. Love is the answer, bro. Love. Love is the answer. I mean, I actually like that, like, I mean, that could just literally be a clip, I ask you this big question and you're like, love. That literally means, I mean, a robot will never love you like that. Human connection, I think, will
Well,
in time will become a lot more stronger, I think,
yeah, yeah.
as we are flooded with all these robots and this AI.
Yeah,
Boy,
the robot will never love you,
that's
but
right.
like we're already seeing some people fall in love with the AIs, which is
Hold that
like,
thought for the next. Hold that thought. Hold that thought for a next episode or some other episode, because that is something we need to discuss it.
set up
Maybe we should discuss that next time.
100%. Let's
We
do it.
have to. Okay, we have to hold that. Leave a cliffhanger here. Hey, nice one, bro. That has been another episode on AI in healthcare and why you should really engage yourself into these revolutions that are happening, and they're happening at lightning speed. So the only way to do that is you either catch up or you follow both of us. And we will try and discuss these new technologies and actually give you our input from a healthcare's perspective of what we think about this, and discuss pros, cons, and limitations. And please like, share, subscribe, all of that stuff to our content. And also, please keep sending these questions, because they really get our brains going, and they benefit us, and hopefully they will benefit you as well. So that's the end of today's podcast, guys. This is me, Abhishek, signing off. Stay safe. Stay Take care, bro.
See you later.